Okay. Okay. The best way to find yourself is to lose yourself in the service of others. Mahatma Gandhi inspired millions around the world to follow him in a movement that inspires millions today to lead more generous lives and impact as many people as they can. My name is Kaushika T OW, and this year I'm studying gastroenterology. I hope to meet several people in the medical profession, make relationships, and learn to embrace the experience to the best of my ability. With this should come an understanding of the lifestyle of a gastroenterologist and the problems they face professionally and how it overlaps in their personal life, their characters, and their morals. This year should teach me where I'm heading in my next few years and what I want to do in college and with my professional career. A little bit about me. I was born in Assam, India, and my family left whenever I was about a month old. My dad is an engineer at Sabre. My mom was a doctor in India and is now a TI graduate student here at a college. And my sister is a 20-year-old junior in pre-med at UTD. I also have a dog. His name's Simba. He's perfect. I used to play tennis very competitively in middle school, and then I quit to join the band my freshman, sophomore, and junior year, where I played flute and piccolo in the top group. Right now, I'm very involved in art. I'm competitive, and I really enjoy it, and I hope to pursue it in college. I will be going to college at UTD my freshman or next year, and pursuing medical aspirations, and hoping to become a gastroenterologist. So, gastroenterology, it sounds it sounds really fancy, but it's basically your digestive system. Your digestive system functions off a 25-foot long tube that processes food along with your liver, pancreas, and gallbladder. The primary purpose of a GI doctor is to discover what's going wrong with that system whenever you go in for a doctor's visit. So symptoms could be heartburn, rumbling, nausea, bloating, excessive flatulence, constipation. You get the idea. The symptoms are clues, and it's the doctor's job to discover the deeper problem. So, I had 6 interviews overall. My first was with Dr. Kaplan, who wasn't actually a GI doctor. He was a colorectal surgeon. So whenever I first came to him, I realized that I would have to ask broader questions that had to do with doctors in general, maybe not so specific to GI. So whenever I went there, we focused on his education, and he was really competitive in his college years, and he worked with people who ended up going to like Harvard medicine and Yale medicine. But the interview kind of turned around, and he focused his questions more towards me at some point, and he asked me why I wanted to become a doctor. And I really couldn't answer at the moment, which I felt really bad about. But I always thought I wanted to become a doctor because my mom was a doctor, and she kind of pushed that profession onto me. But as I looked more and more into it, I realized that you really have to have an altruistic streak to find that satisfaction in a lifestyle of a doctor. So that was really interesting to me, and he's really helped me figure out why I wanted to do this profession and why I want to keep on the track, even if it's not to become GI, but generally why becoming a doctor is my ultimate life goal. Next, I met with Dr. Kubilian. She was the first woman I met with, and she was the most excited because she was also one of the younger doctors that I met with. She really got into the technicalities of the medical process, her college years, her 1-year residency, her second year second year is to decide the subspecialty and then apply for your subspecialty. Then you've got 3 years of fellowship in which you learned about things more specific to GI, like endoscopy and colonoscopies. So she showed me really cool pictures of people who had like cars and forks, and like psychiatric patients had done crazy things, like swallowed crazy things because they were insane, basically. And she made the profession sound like so much fun that I walked out of there really excited for what I wanted to do. I actually asked her to be she was one of my first choices to become a mentor, but she was so busy that she didn't have the time. But she was super fun, and that interview was awesome and very memorable. Up next, I interviewed Dr. Kellenberger, who worked in GI before, but now he is a PA. He's also a nutritionist. So again, we talked about the broader subject. We talked about the step 1, 2, and 3 tests used to determine whether doctors are competent enough to practice. He also touched back on his earlier education, and, well, actually, more so than Dr. Kellenberger, my next interview was Dr. Aurora, and both of them touched back on their earlier education where, quote unquote, they both said the same term. They said that a lot of medical professors had a snooty-tooty attitude, and that a lot of the times they try to rip you down in college, and they're like, you're not going to make it, like half of you guys are not going to be in this room by the end of the year. So they both advised me to really like push through and pursue what I want to do, and again, really know why I wanted to be there and what my goals were. Dr. Aurora worked at Presbyterian, and he made me realize I really wanted to be hands-on in GI, which meant the colonoscopies and the endoscopies. So that was very fun. Dr. Blondet was a second-year fellow. She was the next woman I met with, and she was really nice. We talked about her research a lot, which she was working with mice to test the different effects Tylenol had on mice and how the genetics was connected to children's medicine. So she was the first person who was really involved in research, which was super interesting to me because that's where I mainly want to be. And she knew my next interviewee, Dr. Sauté, who's now my mentor. And Dr. Sauté told me how Dr. Blondet was in a lot of the research field, but Dr. Sauté had more of an interest in teaching. So she explained to me how you can incorporate your different interests into the medical field, and how there are a lot of different fields that you can incorporate a lot of different activities into. So Dr. Sauté also told me that I shouldn't be involved in private practice, which was actually one of my further along goals, because you would think after you go to be a doctor and get a steady profession, you would open up your own practice. But with the private practice, you don't have the resources or the finances to really efficiently create a good career and a satisfying career. So by the end of the interview, I immediately asked her if she wanted to be my mentor, and she said yes, because this was my 6th interview, and at this point, I was so desperate to find someone. But Dr. Megan Sauté is a graduate at Wellesley College and at the University of Miami Miller School of Medicine. She completed her internship at pediatrics and her fellowship in GI and nutrition at Southwestern. So she had a lot of personal input to what I should do in my future and how I should go about applying to different medical schools, and what I should do now, she shadowing different doctors to further my own resume. Next was the research portion of my project. My first research assessment was about argon plasma coagulation, which is basically a 40-watt radial process in which a patient for periampullary bleeding for the pimpilla, is treated by little bursts of radiology in their tract. So that was super interesting, and this was very specific to a GI disorder. So there wasn't a lot I could gather from that, but it was interesting to see how they went about treating different situations that they don't previously have good treatments for at this point. My next assessment had to do with endoscopic ultrasound. Colonoscopies let doctors see ulcers, which is inflamed mucus lining, and abnormal growths. Dr. Kubelian was actually doing research on this, so I familiarized myself with the process and what they're researching as of right now, because they haven't actually set a plan forward to change anything. They're just doing a lot of research. So she helped gather information on that, and she just wanted me to familiarize myself with that. That was really interesting. My third assessment focused on bedside manners. So I've met a lot of people who are really unsatisfied with their doctor visits, where they go and check in and doctors don't really look at them. They just kind of look them over and they're like, oh, you're fine, you take this standard medicine and you're good to go home, which a lot of the times it's not true. It's unthorough. So I researched the different approaches that doctors take whenever they see a patient, and it should be pretty thorough. basically. Each doctor takes a personalized approach, which is definitely connected to their own histories of doctor visits, but in general, it's supposed to be very thorough. I know a lot of people don't have issues with this, but if you're having an issue with that, I realize that you really need to take it up with their supervisor or someone else if it's really a big problem. But in general, doctors are extremely thorough, and they do have a standard procedure. My next assessment was over the Doctors Without Borders program. This program is something I hope to be involved with in my future, and it's where people get to travel to different countries around the world to help treat people in war zones who are malnourished and in impoverished countries and more. It's totally independent of political, religious, and military agenda. I definitely see this program in my future, and I hope to pursue it alongside my other medical aspirations. One of my interviews also had to do with my RUNT trip, in which I interviewed an OChem teacher who was extremely helpful. She kind of taught me the different students that she sees whenever they're first entering college and why OChem seems to have such a bad reputation among college students. It mainly has to do with the change of workload and study habits. So she kind of calmed down my college fears, which was super helpful. And she also has a lot of medical students, of course. And she said that if you put the work and effort in and you talk to your professors individually, I mean, they will help you along in college. And not to be so scared, basically. It was really insightful, everything that I learned from her. My other class had to do with radiology, which again went back to the endoscopic ultrasound that I was talking about before in the argon plasma coagulation. I thought it would help me kind of grasp those two concepts, but it was a junior level class, and I was so overwhelmed with all the information that they were reading. I probably kept up with like a fourth of it. But both of those classes were extremely helpful, and I'm glad I went. My other assessments had more to do with specific conditions that had been brought up during my interviews. So I'll just mention a few of them and briefly explain what they mean. Ascites is fluid buildup in the abdominal cavity. So Dr. Blondette was actually looking at that and seeing how the Tylenol was affecting that situation. Barrett's esophagus is the repetitive damage to the esophagus cells by heartburn or acid reflux. I chose to look this up because it's a very common disease, and especially in pediatrics, it's basically like what most people come in for, especially children. Irritable bowel syndrome, again, it's the most common disease. It's disruption of the function of the colon, which is usually just fixed by liquid diets. So that was the research portion of my ISM work. My original work focused on the first part of it focused on diarrhea, which sounds absurd, but it's one of the leading causes of death in third world countries. It leads to malnutrition, and since there's hardly any water in these areas, it's become a very big problem and is one of the leading causes of death around the world. So I researched the issues of diarrhea and why it was becoming so prominent, and then I talked about my original work was to make a well-researched plan to distribute charitable funds across the different sections of the Compassion Program. So as you can see, diarrhea is kind of a huge GI problem, and there are a lot of charities in place to help distribute funds and create better standards of living for these third world countries. So next I researched the different aspects that surveys are taking into consideration whenever conducting these surveys. But the problem was mainly education, and that you found that a lot of the families in these rural areas weren't taking healthcare as a priority, and that they were focusing on making money and providing food, but healthcare was farther down the list. So with these programs that I was researching, they were very private about how they were distributing their funds, and I found that a lot of them don't have I don't want to say integrity, but they aren't so trustable. Like, a lot of their funds go back to their own, like, corporation or company or fundraiser. But I found this program called Compassion that's very open about their funds. And with this program, I hope to raise funds through different companies like CC's, Panera's, both of which I'm talking to right now, to raise money for this program, and then distribute the money across their medical center, sponsor a kid for only $38 a month for at least a year, and also help their water plan, because a lot of the water that they're getting is dirty and not pure, and that's leading to a lot of the GI problems. So that's my original work, and thank you for your time.